In our first case, a 28-year-old man presents to the OPD with multiple hematomas over the limbs and associated knee joint pain since 1 month. Hematoma is basically collection of blood outside the blood vessels. So that means blood is leaking from the blood vessels, and it happens generally when there is injury to the blood vessels. In this case, PT and BT, that is prothrombin time and bleeding time, were normal. However, APTT, activated partial thromboplastin time, was prolonged. X-ray of knee joint revealed bleeding into the joints. What is the most probable diagnosis in this case, and what is the etiology and treatment for the condition? Then what is prothrombin time? What are the components of Virchow's triad, and what is basically protein C? Well, in our case, the presence of hematomas and prothrombin time and bleeding time being normal while APTT being prolonged suggests that there is a problem with the clotting factors of intrinsic pathway. Because what happens that various blood vessels keep getting injured in day-to-day life. However, blood doesn't leak out of them like that and forms hematomas. Only when coagulation is not occurring, then there will be hematoma formation. Now in this case, prothrombin time being normal suggests that the factors, clotting factors of extrinsic pathway are normal. And the bleeding time being normal suggests that platelets are also working fine. It is basically the clotting factors of intrinsic pathway which are affected, and one of the condition in which it occurs is hemophilia A, and it is one of the most common cause of deficient clotting factors of intrinsic pathway, and that too in hemophilia A it is deficiency of factor 8. So etiology of this condition is basically it is an X-linked recessive bleeding disorder, and it being X-linked recessive, women are generally carriers, because if both the X chromosomes are affected, then the disease is generally fatal. So the surviving females are basically carrier and the disease affects the males. And what is the problem? It is the factor 8 deficiency which occurs in hemophilia A. Now, for treating this condition, basically we need to replace the factor 8 which is deficient in blood. So for that, either we can transfuse fresh blood, or we can give a concentrate of factor 8 itself, or even fresh frozen plasma or cryoprecipitate can be given. Cryoprecipitate is basically a derivative from the blood which is donated. So cryoprecipitate is very rich in the clotting factors. So any of these can be given for treatment of factor 8 deficiency. Now what is prothrombin time? Well, prothrombin time is a test for assessing the functioning of extrinsic pathway and the common pathway of coagulation. So because common pathway is common to both intrinsic as well as extrinsic pathway, if common pathway factors are affected, then what will happen? Both prothrombin time and APTT are going to be prolonged. However, if it is only the factors of extrinsic pathway exclusively are involved, then only prothrombin time is going to be increased. So prothrombin time gets prolonged in factor 2, 5, 10 deficiency, which are basically involved in common pathway, and factor 7, which is the initiating point of extrinsic pathway. And normally prothrombin time ranges from 12 to 16 seconds. Our next question asked about Virchow's triad. Virchow's triad is a triad where there is endothelial injury, sluggish blood flow, and hypercoagulability of blood. And when these all three features are present, then there are high chances of thrombosis to occur. So for thrombosis, there should be endothelial injury, sluggish blood flow should be present, and hypercoagulability of blood, and this increases the chances of thrombosis. And finally, what is protein C? Protein C is basically a physiological anticoagulant which is present in blood, and it is involved in keeping the blood in a fluid form if the coagulation is obviously not required. So it is not a procoagulant, rather it is an anticoagulant. It is vitamin K dependent protein and it works by inactivating factor 5 and factor 7A. And this protein C is activated by another protein, thrombomodulin, which is basically present on the intact endothelial layer of the vessel.